Alrighty, welcome everybody. This is our last chat at the back of the semester. So I am really excited to end this with dietitian Carolina Guizar. And I always used to say Guizar. Is it
It's
Guizar?
Guizar.
Yeah.
There's
I always
a
used to say Guizar, and it's Guizar. There's the guy. Do you prefer Carol or Carolina?
Carolina fits in Spanish, Carol fits in English. Either one, honestly. I don't really have a preference.
So Carolina and I go way back. I feel very thankful that I have had an opportunity to work with her. Like we have shared clients in the past, and so we have collaborated before from the therapist and dietitian perspective with clients that have struggled with disordered eating or eating disorder. And one of the questions that came up from one of the students was asking about like, what does collaboration look like? Let's do more about that in a little bit. And Carolina and I created a course together for the Latinx community that was wanting to heal their relationship with food and their bodies. So I'm definitely very excited to have you here. So all that being said, I'm going to pass it on to you. Please introduce yourself. Who are you? What do you do? What is that? All that good stuff.
Yeah. So my name is Carolina Guizar, and I live in New York City. And I'm a dietitian, and I work in a private practice setting. I see patients with all sorts of conditions, eating disorders, people who are just sort of like chronic dieters, people who are confused about like, how do I eat quote unquote healthy? I don't even know what that means because there's a lot of like confusing information being thrown at me. I work a lot with IBS, irritable bowel syndrome, small intestinal bacterial overgrowth, which is SIBO, and PCOS, a little bit of diabetes, and I feel like things like high cholesterol. I feel like, and I'm venturing a little bit more into the GI, gastrointestinal space. So I've been working with more sort of like conditions I have probably been, dealing with, but didn't know I was dealing with, but histamine intolerance, and Crohn's, ulcerative colitis, like the sort of like harder conditions to manage.
Two lines of like chronic illness as well.
Yeah, exactly. Right. So, that's been coming across my, my office, over the last year. So I've been playing a little bit more around that, but right now I'm actually like 33 and a half weeks pregnant. So my practice is winding down, and I'm going to be taking parental leave for anywhere from 4 to 6 months. So I sort of have to feel it out. But I work for myself. I am a bit of a lone wolf in that respect, where I don't want to be in a traditional office setting. I like making my own schedule and, taking off when I need to and things like that. So, yeah, I see, patients weekly, bi-weekly, sometimes monthly. Every once in a while, I have people I just check in with like every 2 or 3 months or 6 months. So I tend to have very long-term relationships with clients, just the nature of the work that I do, especially with disordered eating. Those tend to be very long-term relationships, or relationships like diabetes, where they're chronic conditions that are very much influenced by nutrition. Those tend to have a lot more follow-up than like, I don't know, I have some patients who I see for like 2 or 3 sessions, and we get a lot of improvement in those sessions, and then I don't really see them again, which to me usually is a sign of positive things because they feel good. So yeah, that's a little bit about what I do, my practice. My philosophy, I identify as a health at every size aligned practitioner, which means I do not use weight as a marker for health. So I do not weigh clients unless it is absolutely medically necessary. If I know somebody has a restrictive eating disorder and they've lost a significant amount of weight, like that's usually the only time I weigh people, to just sort of see how their weight is tracking in their recovery. Other than that, I don't care about the BMI. I don't care about the number on the scale. I'm more concerned with, how do you feel about your relationship with your body and your relationship with food. So I do not actively help people lose weight. I don't judge people who want to lose weight, but I don't actively help them in that journey. So I'm much more about like, what comes up for you around your weight and your relationship with your body. That being said, that doesn't mean I don't talk about nutrition, because again, I work with conditions that are influenced by food. So like in the case of diabetes, yes, like there, for certain people who are concerned about managing their blood sugars, there are conversations around specific nutrients, what foods to pay a little bit more attention to, which ones to be a little bit more aware of. And so there are definitely times I talk about food specifics, but a lot of what I do is more the relationship that people have with food and their bodies. Is that a summary? Is that a good summary?
Great job. Yes. There's always more that'll come up as soon as the moment as soon as we stop recording. Yeah. And I already have a couple of questions because the people that are going to be seeing these videos are going to be like master student level counseling students. And so for a lot of people, I actually got like some very interesting looks when I told them that I had added like a dietitian to my list of people I wanted to interview. Yeah. And I think a lot of people don't necessarily see the connection between the work that like a dietitian therapist does. So there's a couple of things that you named that I wanted to ask you a little bit more about. So for example, you named health at every size, and what does that mean for you? Yeah. And the very popular rebuttal that I get is like, well, you can't be healthy at every size. And so I'm wondering what would be like, what would you respond to that? Because I usually get a lot of people confuse like healthy at every size and health at every size too.
Yeah. I feel like, this is such a complicated question to answer, right? Like health for me, like there's always layers to this question to answer. So I can't just answer it in one sentence. To me, health is individual, right? So health is going to mean something different to each person depending on their age, their genetics, their social conditions, their upbringing, economic status, education, financial status, housing status. Like there's just so many layers to the things that influence health that are beyond food and exercise. Like most of the time when we think health, everything gets very distilled to just diet and exercise. And it's like, whoa, we're missing like the bigger picture here. Like, let's zoom out. And I think the reason we want to zoom in is because we live in a very individualistic culture that wants to simplify and put responsibility on the individual for their life circumstances. And we know that it's not that easy, right? Like I'm never going to say diet, nutrition, and exercise have nothing to do with health. Yeah, they impact physical health. But we have to look at the bigger picture of the person that is in front of us, right? And I don't think the world we live in is very good at looking at the nuance and the things that impact not just physical health, but mental health, emotional health, and social health. So to me, when I say health, I'm looking at mental, physical, mental, emotional, physical, and social health. And so because of the world we live in, the world likes to, how do I explain this? I haven't explained this in a while. We want to make things simple. We want to make them easy, right?
We want control.
Yeah, right. Which like human beings just are naturally wired for that. But so when I say like health at every size, to me, it's just going to depend on the person who's in front of me, right? And there are some people who are, the way our world operates is we have this assumption that like people in larger bodies are unhealthy, right? Like that's just the culture that we live in. We live in a culture that is very fat phobic, again, very individualistic, wants to blame the individual for everything. And it's not the warmest and most, again, forgiving or nuanced approach to the human. And so we live in this world that's very fat phobic, and everything, well, you know, if you just get your weight under control, then all these things will improve. And it's not necessarily true, number one. And number two, some people, like, I think the other part that kind of gets lost in this conversation is that some people, some people are genetically predisposed to certain things, right? Like that you cannot control for, right? So I got diagnosed with gestational diabetes. I am a person, I am physically active. I eat in a pretty varied, nutrient dense way. Like I don't have a, you know, I'm privileged in that I don't have a lot of stress in my life. Still happened. But you would think I'm a person in a thin body too. And so that the assumption, right, is like, oh, this wouldn't happen to somebody like me because of the world that we live in, but like it did. And I didn't do anything to bring this on, right? But I think there's a lot of, in our world, there's a lot of this belief that like certain bodies are predisposed to certain health conditions. And I think there's just a lot more nuance there because it goes wider than just the body size. And I don't know if I'm communicating that well, but I don't know.
Absolutely are. You are. And for those that are watching later, like Carolina is giving such a great example of how social justice issues absolutely come into the conversations of like health. And by health, I'm also including mental health aspects of things. And so, to be honest, I don't know how there are practitioners out there that don't like also address the many other layers that come with that, like the many intersections that come up with health, instead of just focusing on like, well, you know, like the universal solution of like, well, if you lost weight, then all of these things would go away, right? And so one of the questions that came in was actually about, and I think this is what they're kind of talking about. They said, can you talk on the relationship between losing weight and feeling less depressed, right? So like many times we're giving this like lazy formula, if you were to ask me, of like, well, if you were to lose weight, then you would feel better.
Yeah.
Can you talk a little bit about that? So the question again was, can you talk on the relationship between losing weight and feeling less depressed? I think that's what they're naming.
Well, and oh God, I feel like my brain is going in 30 million directions because I feel like I need to explain a lot, like back up so much. So number one, okay, so we live in a world that is fat phobic. The world is not kind to people at certain weights. There is this belief that like weight is linked to health. So if you are thin, you will be healthy. If you are fat, you will be unhealthy. And when I say the word fat, I use it neutrally. It's a neutral descriptor. It describes a body size the same way thin describes somebody who is smaller. So I do not say that in a disparaging way. But that's the assumption, right? And if you lose weight, you will be physically healthier. So that's like the number one, right? So we live in a very fat phobic world that ties weight to health. And again, they don't really define health, but the assumption is generally physical health, right? Because they like to take mental health out of the equation. And, you know, in the work that Melissa and I have done, like the roots of fatphobia are ugly. They are racist. Like people who promoted thinness as the ideal were into eugenics. Like it's really, really ugly stuff. And I think a lot of people don't realize that. And so that if if this is new information to you, I would suggest reading, it's a very dense book, but Sabrina String's Fearing the Black Body sheds a lot of light on this. Like the BMI was based on white European men in the 1800s. And so it has a lot of really dark, like I said, ugly roots, and it's still being used as a proxy for health now. And I mean, I don't use it in my practice. I think it's extremely problematic for people. And because there's just like body diversity is just a thing that has always been around. Like you look back at like statues that were, 3,000, 5,000 years old, they're all like curvy bodies. Like thin, there were thin people back then for sure, but like that was not the preferred body size. And so fat bodies have been around forever and will be around forever. And unfortunately, some people do not like this. And it creates the system of oppression for people at higher weights in particular. And then it ends up impacting everybody else too. And because everybody is fearful of weight gain. And because our society creates like a hierarchy of bodies where thin bodies are at the top and bigger bodies are at the bottom, right? And if you layer in other marginalizations into that, it gets even a lot more complicated. So like, if you are fat and white, you are going to be treated differently than if you are fat and black. And, if you add even more marginalization to that, the reality is people get treated differently, and it's not okay. It's a human rights issue. So that's why I'm like, God, these questions, like I can't even get to that question until I give like the background. This is where I'm coming from. And again, if this is like new information for you, it can be a lot to sit with when you hear this for the first time. It can be uncomfortable. But like, I don't know, in my head, I'm like, there's no denying that these are things. Like I see them all the time in my patients who deal with who have marginalized identities. So, and like, even, I'm Latina, I'm thin, I'm white passing. I know I've been treated differently compared to other Latinos in my life who aren't thin, who aren't light skinned, who don't have European features. Like they get treated very differently than I do. So this is just stuff like we cannot deny. And again, this feeds into that social hierarchy that, people see in the world, and it's shitty. So that's a very long starter response to then answer the question, can you talk on the relationship between losing weight and feeling less depressed? And I feel like there's maybe two answers for that question, which is my observation. People feel less depressed when they lose weight because of their internalized fat phobia, and they feel less stigmatized in their bodies. They feel more praise. People notice when they lose weight. People, oh my God, oh, you look so good when you lose weight. Who doesn't feel good about themselves when people are saying positive things about them? Somebody compliments me on I love nail art. Somebody compliments me on my nail art. I'm like, it just makes my day. We're humans, we're social animals. We want to be accepted. We want to be loved. We want to feel like we belong. And so external validation for a lot of us is really important. And if you are in a body that is especially stigmatized, especially higher weight folks, and they lose weight, they get more praise. They get more romantic interests. They might make more money. They might be offered different jobs.
Greater accommodations.
What?
Greater accommodations.
Right? They might fit into the plane seat better. Like there's right? They might be able to walk into a store on the street and find clothing that fits their bodies, their smaller bodies, right? More easily. And so, yeah, they feel less depressed when people aren't giving them unsolicited comments, negative unsolicited comments, or they're perceiving that their bodies don't fit into the world because the bodies, this world does not accommodate higher weight bodies. And so, yeah, a lot of people will feel less depressed when they lose weight because of the alleviation of that internalized fat phobia and the positive attention that they're getting. That's my first observation. I don't know if you would add anything to that.
No, I agree. And sometimes I come across questions like these and I'm like, I wish it was that simple.
I know.
I could say, yes, my client's going to lose weight. And that means that they're going to feel they're not going to be depressed anymore. And the truth of the matter is that that's not it. You may notice like feeling some alleviation and
Yes.
like how the world is treating you. And I would want to know a lot more about like, where's this depression coming from, especially with some of the stuff that, a lot of the stuff that you named earlier, of like, what other layers are we talking about here? What other layers are we addressing? Are we talking about stressors that this person is experiencing? Any like racism that they may be?
Right. Yeah. And so that's why these questions are like, they're not very simple to answer. The other part in this, I think you sort of just touched on it. What I have also noticed is that the relief from the depression is temporary often. And that because the underlying issues are still there. Like, and I don't know if you would agree with this or not, but to me, often what's underneath people's desire for weight loss is that wanting to belong, wanting to be loved, wanting to feel noticed, not wanting to stand out too much, right? Not being criticized, wanting to feel safe. What?
Feeling worthy.
Yeah.
And the thing that I'm sitting with also is like, a question like this also assumes that thin people don't struggle with depression.
Yeah. Yeah.
I think there's always this assumption that you're in a fat body, then that means you must be unhappy and depressed too.
Yeah. And that's not necessarily the case.
Mm-hmm.
No. So that's another thing, is a lot of people make the assumption like higher weight folks want to lose weight. Oh, you can't feel good at that body size. And it's like, not necessary, not maybe for some people. And then for other people are, able to accept their bodies at the size that they're at. It's not easy in this world, but it's possible. The other thing, so that's sort of like this other layer to this. This is like a more clinical answer to maybe people who might, I don't know, I'm trying to think, like there are some people, and again, this is not the focus of my practice, so I can't super speak to this, but I know it does happen to some folks where they will make like some changes to their diet. And they're like, oh, let me be more intentional about fruits and vegetables. Let me be more intentional about drinking less, moving my body in ways that feel good, hydrating more, let me have more fiber, right? And they do feel physically well. And sometimes, food does have an impact on your microbiome. And your microbiome is like the bacterial makeup, or the makeup of critters that live in your gut, right? And those critters, they're awake, they're alive, they produce certain chemical compounds that some of them do impact mental health. They affect serotonin production. They affect how healthy the lining of the gut is, which, you want, if you can, it's not always possible for people, but a healthy barrier in the gut. You want a healthy like membrane in it, and you want healthy functioning as much as is possible or is accessible to the person. I'm always like very careful about how I say this, because again, like there's again, it's not just about diet. Stress will affect gut health, things like that. But assuming a person is like kind of in a stable period of their life, things feel okay overall. I've seen cases where people are like, oh yeah, I was intentional. I've been a little bit more intentional about what I've been eating and thinking about how does this make me feel physically, emotionally. And they do see some improvement in like markers of mental health. They feel well. I think whenever I say this stuff, I'm always very hesitant because I don't want it to get it like, this is not a blanket statement for everybody, right? If I'm working with a person in recovery from an eating disorder, I am not having this conversation.
That's a really important point.
Huh?
That's a really important point, because a lot of times we have like counselors in training that are like eager to have these conversations, and it very much depends on where your client may be and what you need to be addressing first.
Because I have seen the impact, and again, clinicians are well-meaning. And actually this is like referring to what is the role between the dietitian and the counselor here?
Yeah, so one of the questions that came in
Collaborate.
was like, what does collaborating with the dietitian look like?
Yeah. So what I have seen in the past, because, you know, and this happens on the internet where it's like, eat more fruits and vegetables for less depression, like these very like generic statements. And so
The commercials.
and people will then just be like, oh, you feel depressed? Like, why don't you just eat healthier? And it's like, it's a little bit more complicated than that. And because statements like that can actually have a harmful impact on the patient, because then the patient blames themselves. They're like, well, I'm depressed because I'm not eating well. And then they put pressure on themselves to eat well, whatever that means to them, because there's no clear definition for that. And then they get stressed out that they're not doing enough. And it's like, you might just need medication. It might not have anything to do with your diet.
Sometimes I'm going to name exactly what you named earlier. Like, you may just have to focus on like, does this client even have access to food?
Oh my God.
Altogether.
Like, how do you, these conversations, I've had food insecure patients in the past.
Mm-hmm.
How are you going to tell a food insecure patient to just eat more fruits and vegetables? Especially when they have no time to cook or no money to cook or no stable housing in which to cook. Like, and so this is where I'm like, people really have to be careful with their recommendations around food and movement, especially, and really have, I mean, like when I get into conversations around movement or specifics around food, I have multiple sessions to discuss this with people. And I am very intentional about like, what has been your past experience with these, like bringing in nutrition intentionally, and then bringing in movement intentionally. And then like, how do we make this feel safe for you? But there's so much intention and slowing things. I'm never just throwing out, why don't you do this? Why don't you do that? Have you tried this? No. That I have seen cause a lot of harm for people. The other thing in this, there is overlap between what Melissa and I do in that, like, I am not just talking about food. I'm like, how do you feel about that? Right. But I'm not a therapist, but there's like a little gray area. I will say from a counselor perspective, I would not touch specifics around food. That's like the one thing where just like, I do not ask about like, tell me about your trauma. Like if somebody shares their trauma, I will listen, but then I will often be like, have you talked to a therapist about this? Right. Because I'm like, not gonna, it's not that I'm going to ignore that, but I cannot touch, I literally can't touch that.
Not, and I'm saying this to the counselors in training, counselors, I feel like this message is going to go to lots of different people. We are not trained dietitians. We are not dietitians. And I think, and I am specific about being a dietitian because you all go through very extensive training, learning about food and the body. Like even doctors don't have that type of training. And so it's really important for us to be aware of like what our scope of practice. It's also the reason why it is crucial. And I think depending on the client and what kind of access do they have, to seeing a dietitian, always crucial for me because I specialize in eating disorders, for me to be working with a dietitian because I can't educate my clients on the food aspect of it. I can check in with them and I feel like I've learned a lot from my colleagues. And there's no way that I'm just not trained in that.
No. Well, and you ask, in the clients that we've shared, you do talk about relationship with food stuff.
Yes.
Right. But like you stop at how much fiber are you eating? Have you tried this? Have you tried that? You might say, are you eating enough? Why is it hard to eat X amount of meals a day? Or why is it hard to eat X food? You can check in about that stuff, but like, it's just been my experience that when not just non-dietitians, because like dietitians can do a lot of harm too, but when dietitians who are not trained well in assessing like where the client is at in their relationship with food in their body starts giving out advice. And by the way, I've made this mistake where I spit out shit sorry, whoops, sorry, stuff
Absolutely okay.
too early, because I get excited about like, oh, let me share this bit of information for you. And then it backfires on me. And I'm like, why did I say that? What was I thinking? Because now the client's like latching onto it. Right. So I've made that mistake. So I don't want to make it seem like I'm imperfect. But like
I think it's important to name that as practitioners, like including dietitians and counselors, we are very much in a position of power in which whatever we say, like we have to say it responsibly, because I would say more so specific communities. I'm thinking about the Latinx community, for example, because I don't want to speak for others, but there's definitely like this power dynamic in which there's like so much high regard for practitioners, including therapists, including dietitians, in which like we will listen to what you have to say and follow instructions. And sometimes that comes from become very rigid, depending on who you're speaking to.
Yeah. So you have to be really, really careful about what you're saying, because your words really do have power. And I've had so many clients, especially clients who's, let's say, you know, they're an insurance client and their therapist is an insurance, you know, they have to go to that therapist because therapist takes their insurance, and therapist not only just not trained in eating disorders, has their own eating and food issues that they haven't worked through. And they'll just give them advice. Was like, the client will be like, well, I'm struggling with overeating sugar. And the therapist will be like, well, just cut it out. And it's like, whoa. What, like, or yeah.
These are real stories, by the way. Like these are things that we've heard.
Yeah. PCOS patients of mine like deal with a lot of inflammation. So the doctors will just be like, well, just cut out gluten and dairy, or just go low glycemic. Like they just throw out this information without like stopping to think about the impact of what they're recommending and what that might mean. And then the client shows up in my office, well, my doctor said I have to eat this way, or my therapist said I should just cut out sugar or stop eating this or that. And I'm like, whoa, wait, why? Why? B, what?
How?
Rationale? And be like, how is that making you feel? And like, is that even true? Like, and by the way, it's not true, but
I have some similar questions that came up. So Nate, I'm sorry, and I'm aware of time because I can't remember what time do you have to leave.
I mean, I can go over.
Okay, so related to what you just said, there were two questions, kind of three, that came up. One of them was about keto, the other one was about SIBO, the other one was about IBS.
Keto, sorry.
So the keto one, yeah, I
can't help my facial. I'm a very expressive person.
That's okay. We love that here. So there was one question for those that don't know what it is. So it was, what are your thoughts on keto? It has been recommended to my client to have more energy and concentrate at school.
No. And by the way, I am not criticizing the person asking this question. It's a very fair question. I hear this a lot. My response is just like, oh my God, like, no. Keto. Okay. I have a lot of thoughts on keto. Keto is a medically necessary diet in some instances for people with seizure disorders. That's it. Beyond that, it is a fad diet. And are there some people who can do it, stick with it? They say they feel better. Sure. The vast majority of people I encounter can do it for a little bit of time. And then the body's like, remember carbs? Yeah, we need those. And the cravings for carbs just come roaring back to life. And if the person lost weight, they will, they might start to regain some of that weight, because that's just what the body does, because the body doesn't know you are on a diet for fun or intentionally. The body just perceives calorie deficit and translates that into famine. Like our bodies are under threat. And so the cravings for all of these forbidden foods will come roaring back, especially for the thing that was being restricted, right? So my thoughts on keto are that it is, unless you have a seizure disorder, totally unnecessary, right? Especially for energy and concentration. I would be asking this client, again, refer out to a responsible dietitian, but then asking the client maybe just general questions. Are you eating enough? Are you sleeping well? What is your stress level like? Are you eating consistently? Do you think you're eating a balance of nutrients, right? Because sometimes when people aren't eating enough carbs, they can't focus. They don't have energy because the body's primary fuel source is carbohydrates. I would be asking these questions instead of like defaulting to a diet to improve energy and concentration. Like that.
We hear that so often as if like that, I wish it was that easy, and it's not. And I get that there's a level of grief that comes with that, by the way, y'all, like acknowledging like, no, there's not a quick fix for what you're experiencing right now, as much as we would love that for that to be the case. So even as counselors, like processing, what's it like for you to hear that this may not be it for you? And it actually, what I'm hearing from you, Carol, is that it may actually bring greater consequences. Like if you're telling me you're severely hungry and your body's going through starvation, like I would be very worried about this client's ability to concentrate at school for sure.
If they're eating enough, right?
Mhm.
Well, and if they're not, let's say they are eating enough and they're still having energy and focus problems, like what else is going on?
Yeah. Mhm.
And if for some reason the dietitian is assessing the client and maybe their eating is stable, their weight is stable, they don't have a complicated relationship with food in their body, and they're like, yeah, I'm feeling tired, I'm having concentration issues, then maybe there is a case for, hey, what would it like to try some of these foods? This balance of nutrients, does that work for you? Does that not? How does it feel when I say that to you? Does this feel restricted? Like there's all this like stuff that you can do, but again, you really have to slow down the process, just not throw out this like generic information that like I've never seen this generic information land in a very helpful way for most people. It isn't. What was I gonna?
Oh, go ahead.
Oh, no. I was just going to say that the part of you, like that grief comment that you made, that like, because we live in a world that's like, health is in your hands, health is in your control. Have you done everything you can to fix? I have a client who I just saw yesterday who has IBS. We have we have gotten her symptoms to a very, she came in with IBS diarrhea that was like very erratic, random, happening like once or twice a week. She'd get these like flare-ups of diarrhea. And now we have her, maybe she has symptoms like once, or like she'll have a couple loose stools a month. And then every 2.5 months, she has a little flare-up. We cannot figure out why. She is like spreadsheet person. She keeps track of all her like week. And now she's like, what else can I do? And I literally said to her yesterday, nothing. What is it like for me? What is it like for you when I say that this is probably your baseline, which is way better than when she first came in, but it's not perfect. And she's like, I feel some relief, and a part of me is upset. Sure. That's the nature of chronic illness, is that like, it is variable, it is unpredictable, and it's freaking annoying and upsetting.
It is. Bodies are complicated, and as much as we would love to say that we know about them, there's still a lot that we don't understand. And I think that's very scary for some people. There's just a lot of work to do.
But I think, and as a dietitian, I'm sure this happens as a counselor, like as a dietitian, I was trained to fix.
Yes. Mm-hmm.
So I was not trained to have conversations around, actually, this is as far as I can get you. How does that make you feel? Because I know how it makes me feel. It makes me feel shitty as a practitioner that I can't help you more. On some level, it's a bit of a relief. Like we don't have to be being a detective all the time. That maybe this is just as good as it's going to be, but that doesn't mean that there's not going to be complicated feelings around that. And like, I wasn't trained to have those conversations. I've had to learn how to have those conversations in supervision of like, that really sucks when I say that, doesn't it? And I feel shitty in the moment.
There's a lot of processing that happens in that.
Mm-hmm.
And I would say also a lot of healing that comes with these conversations. So Definitely make time for those and slow down enough to be able to have those conversations too. And I think you said something that's really important, right? At what point are we projecting into our own clients in a sense of like our own desire for control, maybe actually harming our clients with like a route of like treatment in
Yeah.
many ways. So I wanted to talk about something kind of related to some of the questions, but can you speak a little bit on like, what are some of the effects of mental illness that you have seen have an impact on people's physical health?
Ooh. I mean, they're so closely tied. Like the brain and the gut are tied together through the vagus nerve.
Mm-hmm.
And what a lot of people don't fully understand is the gut has its own nervous system. And so it's not just the brain communicating to the gut, it's also the gut communicating back to the brain. So, but, if we're looking at the brain communicating downward through the vagus nerve, if people are dealing with mental health struggles, and usually those cause a lot of instability in people's lives, I always say an irregular gut needs regularity. And that means regularity in schedules, like predictable schedules, routines. And if you are struggling with mental health, self-care is really hard. And one of the pieces of self-care is like sort of predictability. Maybe that's not entirely fair, but like some sense of like consistency in a person's life, right? Even if things are variable in schedules and things like that. But like if a person is really struggling with their mental health, to me, it often shows up in the gut, right? Where someone might be constipated, somebody might have like these diarrhea episodes, indigestion, because the vagus nerve, controls the function, has an impact on the function of the gut. And so if there are signals, neural signals or hormones that aren't functioning well or getting produced adequately, it's going to reduce the function of the gut, right? So stress, especially, if you're talking like polyvagal theory, right? There's the rest and digest phase, fight or flight, and above that is freeze, right? If somebody's in a fight or flight state, it draws blood away from the gut, right? So people will, again, I feel constipated, I feel nauseous, I feel like I have diarrhea, I have reflux, or maybe your appetite, you don't have an appetite, because again, fight or flight shuts down essential functions, might not have an appetite. If people are in freeze, everything kind of slows down. So I see a lot of constipation when people are in a freeze mode. And again, the self-care, like who wants to be thinking about regular food intake? A lot of people don't feel like cooking, they don't have time to cook. And so mental health can, start to have all this impact on food, stress, sleep, and all of this can impact the gut. And
A lot of times, I'm going to go back to what you named in the beginning, it also has an effect on, if you're a person that has diabetes, on your blood work in any shape or form, like on your blood pressure, on your cholesterol levels, it has an effect on that, which is always fascinating to me when some folks will only prescribe okay, dieting or just regulating their diet or whatever we want to call it, but we're not even addressing what are other factors that may be impacting these numbers in your blood work.
Oh my God. I shared, I got diagnosed with gestational diabetes. I was having a very stressed out day last week. And I was like, you know what? I had just checked my blood sugars after a meal, because that's part of my care now. And they were within range. And then I had a very stressful phone call. And I was and I was feeling anxious. And I was like, out of curiosity, what are my blood sugars? I'm going to see. They had jumped up, even though I had eaten, my sugars looked within range. I that's the language I use. An hour before, they were all of a sudden up. And that was the very real impact of stress. And I had to like, okay, I need to, you know, I had to bring myself back down after that. And then they went back down. So these are all like, you know, mental health impacts the physical body through the gut, through other, you know, systems like blood sugars, cortisol, things like that. So, yeah.
Okay, I'm gonna ask you, kind of moving down the list because I'm looking at time still. Well, I guess I like this question, and I'm gonna extend it a little bit more. The question of to diet or not to diet then. But I also want to ask to track calories or not to track calories.
Yeah.
I'm curious as to what your thoughts are.
Yeah. Well,
on either one of those.
Yeah, I consider calorie tracking dieting. So to me, dieting, the word diet can refer to an eating pattern, but in this context, dieting refers to like some sort of food manipulation. Right? So calorie restriction would fall under that umbrella. People can choose to diet. People can choose whatever they want to do with their bodies. They can want to lose weight, they can want to gain weight, like no judgment. My face, because I'm an expressive person, it's like I'm just like I roll the like, why do we even have to be having this conversation, right? And I know why. We live in a fatphobic world. But to diet or not to diet. So people can choose to do what they want with their bodies. No judgment. What I have observed in my practice, I used to work with weight loss way back in the day. I did weight loss with my patients. It does not intend, like, efforts to restrict calories fail for the vast majority of people. And weight, let's say if the person did lose weight because they were changing their diet, right? It would often come back. And I had a few patients who I worked with for over a year, and they would be doing the same thing, or maybe just loosening up a little bit on the diet, and the weight would just jump back up. And they're like, whoa, why is this happening? I'd be like, I don't know. You haven't changed anything, or maybe you've changed a couple, like maybe you're loosening up a little bit, but like, I can't explain this. And so, but the whole point of this is that these are not sustainable, right? This isn't, are there cases where people, again, like somebody is like, like, do I eat enough fiber? Maybe I don't. Let me add in a couple things every day, right? Like, and that doesn't feel complicated for them. I haven't been feeling physically great in my body. Maybe I'm going to go out for walks more. I'm going to try going to the gym, whatever. Are there cases in those instances where people lose some weight? Yeah, sure. Right. Like, and again, I'm a weight neutral practitioner. I'm not like, wow, I'm just like, oh yeah, that's what your body needed to do. Because most of us, like, our weight is within a range. And we either can trend up in the range or down, depending on what's going on with the life. And of course, that range can change over the lifespan, or depending on what's going on medically, medication-wise, things like that. So, but most people like have a range they hang out in. And so depending on what's up, they might be up here, they might be in the middle, they might be on the low end. So even in cases where I have seen people make small changes to their food intake or their exercise patterns, they're not losing tons of weight. They'll lose a few pounds, maybe. Like, I can never put a number on it. Everybody is different, but we're not talking these like numbers that you see on The Biggest Loser, or that you see with people, having bypass. Like,
by the way, I would invite people to read the research studies on like The Biggest Loser kind of.
Yeah, because those mess up people's metabolisms and things like that. So, so even in the cases where I have seen people lose some weight, it's never like these like big changes. It's maybe small. And again, it's probably the body just trending a little bit in the lower part of where their body wants to live. So yeah, so to diet or not to diet, I have not seen any diets that are like intentionally restrictive to work long-term for the vast majority of people. Does that mean they don't work for some people? No, I'm sure some people can live their lives restricting carbohydrates. Good for you, not how I want to live my life and not how most people want to live their lives either. But like for the vast majority of us, those diets are hard to sustain long-term. So to diet or not to diet, it's up to the person.
Yeah, like what's the percentage of like
It's
people that regain weight after dieting?
like 80 to 95% failure rate
Yeah.
of calorie restricted diets, not resulting in long-term. So long-term weight loss being defined as more greater than 2 years or more.
And I will say, like, a lot of times we end up getting the client in the counseling room, and I want to hear your perspective on this in the counseling room, after they've been going on for years and years and years of trying to lose weight, not being able to, and exactly what you named earlier, like immediately blaming themselves. I must not have the discipline for it. I must not be doing something right. It may just be in the psychology of it all.
Yeah. Have I not tried hard enough?
Yeah.
Maybe one more time. And I'm like, this is not your fault. Your body, A, the body fights back against this stuff, and B, your brain fights back against it, not just your physical body. There are parts of your personality, if you are into internal family systems, which dietitians are allowed to be trained in. And I talk a lot about parts work in the work that I do. But if you have like these parts of you that are protective around food, that are they try to counteract the part of you that is restrictive and wants you to lose weight, those parts start to come up a lot, and they will often be in, there's the biological urge to eat the things that are restricted, and then it merges with the psychological part of you that wants to also eat those restricted foods, and that's just a part of you that is protective, because those foods are often delicious. And it's like,
we didn't even get into the conversation today about like cultural stuff. Like today's conversation was very like general, and for the purpose of this, I don't know what this would be called, a webinar, I think at this point. It was very general, but I think like one of the work that you or that you and I have been able to work on together has been very specific to also addressing like cultural, racial identity, just identities altogether, because we also talk a lot about gender and sexuality, and like conversation around food and nutrition is not purely I think that weight is at the very at the tip of that iceberg, but there's so much more underneath it all, that I hope people also remember and come back to.
Yeah. Well, can I add? Can I answer one more? Well, maybe did you have time to answer the other two? Yeah. Okay.
Which one are you looking at, the SIBO or?
Well, look, what are the benefits to referring a client to a dietitian?
Yes.
It takes the pressure off of you to address the nutrition
stuff.
Thank
you for saying that. Thank you for saying that, because when I had just graduated from the master's program, I started doing eating disorders right then. And I thought it was my job to know all the stuff. I thought it was my job to know about medication stuff. I thought it was my job to know about all the food stuff and nutrition, and absolutely not. There's a reason why we collaborate with other people. And I will say that's what I love about the work that I do, is like being able to collaborate with so many other practitioners.
Yeah.
One, personally, I feel like I learn a lot, but also because you're right, it does take off the pressure from like feeling like you have, and you can't do it all. You just can't.
Like, when people like share with me, like, because it's again, the environment I provide, it's not just talking about food. It's like, how do you feel about that? Why do you think you feel that way? Often like people will talk about trauma in their lives. And again, I will sit there and listen and be like, I'm sorry that happened to you. But like, I cannot help them process that trauma. And so it's a relief to me to say, hey, thank you for sharing that. That must have been very hard for you. I'm the dietitian, happy to hear your story, hold space for it. it's hard for me, like, this is kind of where my role ends here. I can't help you process this. Have you talked to somebody outside of me about this? And because that, like, I can't, there's just certain things I'm like, I cannot touch this. And so it's a big relief to me to be like, this is really like firmly in the therapist realm. So I think that's important to address. And it looks like us, like Melissa and I, the times that we've shared clients, we hop on a call once a week and be like, hey, what happened? How was your session with so-and-so this week? We talked about this. We talked about that. I told them to tell you X, Y, Z. Have they brought that up? What are you noticing? How, if I'm having a barrier with a client, I'm like, oh, I feel like there's something I can't get through. Melissa, like, what do you think about this? Like, am I not?
I had a client the other day, hadn't been pooping. I was like, oh no, I have to ask them because sometimes clients forget about these things. But I learned through you, like, ask about pooping. Please ask your clients about whether or not they're pooping, by the way.
Yeah.
And I'm like, okay, definitely got to talk about this with Carolina.
Yeah.
Make sure they address it with the client.
Yeah. What else was I going to answer? Let's see. The SIBO and IBS, how does it affect mental health? Woo. Well, IBS, irritable bowel syndrome, is like, I can't figure out the exact clinical definition of it right now, but it's irregular bowel movements happening. I think it's more than 3 days a week for more than 3 months at a time, where there's been like a change in stool consistency, the quality of the bowel movements, accompanied by visceral hypersensitivity, so pain. So for instance, I do not have IBS. If I am constipated, I don't feel constipated. Like, I might feel like a little heaviness in my belly, or like, but my IBS patients who are constipated will have pain. They feel it, like the nerves in the gut are just over communicating about what's happening in the gut. It happens with my IBS patients with diarrhea. SIBO, small intestinal bacterial overgrowth, can happen in the context of IBS, or it can happen without IBS. So SIBO, oh God, it's one of my favorite things to talk about. But that's another webinar. But SIBO, I will say this now, there's so much like it, even in the dietetic space, and I get so annoyed of like people like, oh, you can cure SIBO with like herbs. No, you cannot. Antibiotics are the only cure for SIBO, and then you have to find the underlying root cause of what is like SIBO just doesn't happen spontaneously. It comes from somewhere. There's some sort of dysfunction happening in the body that is predisposing the person to have an overgrowth of bacteria higher up in the GI tract than it should be. So you need to get them to a competent gastroenterologist. Lots of them are not, I'm not gonna lie.
I was gonna say, a lot of times folks have to specialize on these topics.
I, as the dietitian, have had to be the one to push doctors to test for this, because they're like, oh, no. Oh, the test results are normal. I read the test results. I'm like, these are not normal test results. Because you will be shocked how many GIs like are just not competent around SIBO. So you need to find a competent GI you can refer out to, who takes a wide variety of insurances. And this is all, any of these conditions, when they're not well managed, will impact mental health because they're distressing. They cause distress in people's lives. And I will also say that they've done some studies to show like how the incidence of IBS in people with anxiety and depression, and it's quite high because of the tie between the gut and the brain, or the gut and the brain, I should do this way.
Like, so many of these, like, getting into that conversation of chronic illness, like, you've been struggling with something long enough, that has an impact on your mental health too. Like, you feel exhausted, you feel discouraged, you feel frustrated. A lot of times you feel hopeless. A lot of times people have been having to experience so much pain day after day. Like, this affects you.
And you don't know the amount of patients that show up in my office. They're like, I've seen 7, 10 GIs. No one's been able to figure out what's wrong with me. they're full of stool. They literally have stool up to their small intestine, and no one has caught it. I put them on a supplement,
Yep.
get them to a good GI, clears out, and they're like, what the heck? Like, I've been dealing with this for 5 or 6 years.
It's also the reason why I ask my clients every so often, have you been pooping lately?
Can I answer one more question?
Yes, please.
In food, is it bad to be eating so late? I encourage you, and again, I used to use this language. Move away from the language of good and bad. It's black and white thinking.
Thank you for naming.
Sleep and food, is it, and again, this is nuanced. Is it bad? And I know what you mean by bad. Like, is it not good for, like, it's not good for the body? It depends on the person. If you are a late night worker, it might be great for you, right? If you are having dinner at 7 p.m. and going to bed at 8:30 or 9, and you're getting reflux, maybe not so great for you, right? So it's going to depend on the human that is in front of us. If that is, I have to, as part of my gestational diabetes, I don't have to, my dietitian, I have my own dietitian now, by the way, that's been interesting. She encourages me to have a late night snack, like a snack at like 10 or 10:30. I'm not used to eating that late, but it's supposed to help with the blood sugars for somebody with my condition. I'm not hungry at that time. I still eat something because I have noticed it does have a positive impact on my blood sugars the next morning. So for me, like, I don't want to be eating late. I don't feel physically hungry.
And I'm going to use another example that I get very often with like college students that are my clients. And I think this applies to a lot of other people, right? So I'll use a specific example of like, they have dinner at 7 p.m. and they haven't gone to bed until like 2 p.m. because they've been doing work. And then they're like, well, I feel bad because I'm hungry at 11 p.m. and that's too late. And I'm like, well, how many hours?
Yeah.
Is that since that's the last time that you ate, but also like you're also telling me you've been like doing a lot of work and that uses up a lot of energy too. Like that's also like a very clear example of like, it depends.
Yeah, it depends, right? But then I have patients who have really bad reflux, have to eat before a certain time because they will not be able to sleep. And so for them, is it bad to eat late? Yeah. Right? Can they always help it? No. Sometimes there's a birthday dinner that starts at 8 p.m. and they're going to be uncomfortable when they go to bed. So again, there's like nuance there. Is it bad? Well, it's going to depend on the person, the circumstances. What do they mean by bad?
I love that you pointed that out too, by the way, because there's like like saying whether it's good or bad, it really leaves out all the nuance of the in between. Like,
and it's hard. It's funny. It's hard to change that language initially, but now it's so automatic for me that I have such a reaction to that word now where I'm like, oh God.
I have a reaction with health now, right? Or the word diet, right? Even though like both of those things are not supposed to mean good or bad in any way, they've become like this, like,
oh, they're weaponized.
Yes.
To me, the word healthy, I have such a reaction when people are like, oh, that's unhealthy. That's healthy. And I'm like, I literally have this like reaction of this because to me, those words get weaponized.
Yes.
And they are, depending on the context, most of the time, like quite harmful to people. And so I have to do a lot of, part of the work is like, how are we defining health? What do you mean by healthy? What do you mean by unhealthy? For me, it is healthy to have the snack late at night. The moment I deliver this baby, the gestational diabetes goes away. I'm not gonna do the snack. I don't want the snack.
Oh no.
Okay.
You're gonna start breastfeeding. Well, I mean, or maybe I don't know if you will be or not. That was an assumption. But yes, you're gonna be up later.
That's true. I shouldn't say that. No. You're totally right.
That nuance. There's that nuance.
Thank you for pointing that out though. See, I even make mistakes. Sometimes I say stuff and I'm like, wait, let me roll this back. That did not come out okay. But no, you're 100% right. So, but yeah, I think that's kind of all the biggie oh, those are all the biggies. And that's like, this is such a complicated topic to cover, because you have to like cover the social justice
You have
angle
to.
to this conversation first before we even dive into some of these answers.
Yes. I am really, really thankful for your time
Mhm.
today. Before we end today, there's usually 2 questions that I ask. One of them is, if you could go back in time before you knew any of this stuff, like maybe when you started your own like learning journey, all that good stuff, like what would be one thing that you would tell yourself?
Oh God, I think like, I mean, I'll go back to like regrets, that I think it ties into like regrets that I have, which is, like but this is sort of a larger thing. I wish I wasn't so focused at some point, and this is a fault of like my upbringing and the culture that we live in, so it's not my fault. I wish I hadn't put so much emphasis on like tying my self-worth with my appearance, right? Because it's had such a negative impact on my life. I know why I did that, especially as a Latina. Your appearance is a form of social currency in our culture. But it's had such, I mean, in a sense, it's gotten me to where I am now. So like on one level, I'm like, it's gotten me to the work that I do. But on the other level, it's like, it's just messed with my own journey. And so I wish somebody had said that to me. And I think that, again, that I don't know if that's something I could have changed, but like, I just wish that message was communicated to me. Like, your worth is not tied with your appearance. Your body is going to change with time. That's okay. Like,
Yes.
I wish those things were told to me. And that's, I'm pregnant with my first child. Those are going to be the things this person hears from me. As much as, you can't protect from the outside world, but in this home, that is the message.
Doesn't that make you want to put them just in a bubble?
Oh, yeah. And just, oh my God, I'm so like, especially in New York City, all the talk around food and body is going to be really a lot to deal with.
Well,
What was the second?
oh, the second question. Well, I was going to add you've done so much work as well, like in the work that you do, just from the things that I know you like personally,
Yeah.
that you just know that what you're going to be modeling from home is going to be so different than what you were exposed to. So there's a lot in that.
Yeah.
The other question was, so if people want to follow up with you, maybe follow the work that you do, what would be, and I'll make sure to add that into like whatever.
Yeah. I mean,
bottom would be.
I normally will like give out my social, the name of my practice is Eat Authority. It's a pun on eating and authority. And I used to be the Eat Authority, but then when I switched to like the new approach, it's like, no, I help you become the own authority of your own body and eating.
I love that. Yes. So I'll make sure to link your website.
Link the website. I'm on Instagram at Eathority, EATHORITY, but I'm not active. I really don't love the social
There's
media
some
game.
pretty awesome stuff there, though. If people want to learn a little bit more about what we talked about, like make sure to just scroll through.
Yeah. But if people ever need case consultation or anything like that, or just like, hey, how do I have conversations about health? I do supervision. I'll be taking a little bit of time off with the baby, but it's funny. I don't have a lot of brain space for the client stuff right now, but like consultation stuff, I have emotional space for. So
it's different kind of load. It's a different.
Yeah. It's different. I get to be more prescriptive, which is kind of a fun part of my brain to use. Like more, have you tried this? Have you tried that? I like to do that on occasion. So yeah, that's it.
All right. So we'll end it there. Thank you so much. I appreciate you.
All right. Bye.
Bye.